Bismillahirrahmanirrahim. I would learn about the regional injuries. Part 1. Our objectives are today, at the end of the lecture, the students will be able to describe head, its general consideration, forensic aspects of anatomy of head, classification of regional injuries, and list of the regional injuries, definition and further classification of the head injuries, and about the medical legal aspects of the head injuries. Patterns of the injuries according to the region and potential complications of these injuries are important component in both the clinical and the medical legal evaluation of the trauma case. Regional injuries are enumerated as head injuries, scalp injuries, neck injuries, spinal injuries, chest injuries, abdominal injuries, skull fractures, intracranial hemorrhage, traumatic subarachnoid hemorrhage, and brain injury. It also includes chest injuries, blunt injuries, penetrating injuries, abdominal injuries, blunt force injuries, penetrating injuries. These are all the types of the injuries which occur from head to toe. If we define head injury, a head injury is defined as any sort of injury to the brain, scalp and face. This can range from a mild bump or bruise to a traumatic brain injury. Common head injuries include concussions, skull fractures, and wounds. The consequences and treatment varies accordingly depending upon the cause of the injuries and severity of the case. Head injuries. It, uh, head injury can be divided as a closed wound or open wound in the circumstances. A closed head injury is any injury that doesn't break the scalp, while an open head injury um, is one that is something uh, penetrating scalp and enters into the brain. While assessing the head injury, it can be hard to assess how serious a head injury is. Just take a look. Some minor head injuries bleed a lot, while because the scalp has a large number of blood vessels, and in the case of trauma, it bleeds a lot. While some major injuries doesn't bleed at all. It is important to treat all head injury cases and get them assessed by a doctor or neurosurgeon and investigations by MRI and CT scan are the treatment options. What are the common type of injuries which occur on the head or can be seen by medical legal examination? Um, the types of the injuries which are very important in the medical legal sense are abrasions, contusions, bruise, lacerations, lesion, scalp injuries, fracture of a skull, then cerebral contusion, subarachnoid hemorrhage, intraventricular hemorrhage, fontaine hemorrhage, hemorrhage and internal, extradural hemorrhage, and intracranial hemorrhage. Visible injuries are uh, abrasions, contusions, bruise, laceration, scalp injuries, incisions, penetrating injuries. They are visible from the on the scalp, while fracture of scalp and hemorrhage, internal hemorrhages of the brain, they are visible by the MRI or CT scan investigations. What causes a head injury? Head injury may be the result of direct or indirect violence. In cases of the assault, direct head injuries occur under the impact, and indirect head injuries occur due to the transmission of force to the head from an other side of impact that may be the feet, buttocks, etc. Direct uh, head injuries, compression injuries, uh, which are called compressed injuries or impact injuries. They result from the road traffic accidents. In delivery cases, forced delivery, uh, fall from the height, repeated blows to the head. In sports cases, in boxing, sometimes moving objects strikes the head, like the bullets discharged from the firearms, while indirect injury occur from injury to other parts of the body. Fall on the buttock or fall on the buttock in case of fall from height or blows to the chin in a place of accident. Head injuries. Major causes of the head injuries are associated with the uh, motor vehicle accidents. In road traffic accidents, many uh, majority of the cases occur from road traffic accidents. They are being brought in the hospital and for the medical treatment purpose and the medical legal assessment of the injuries. Uh, we can see daily such type of cases which are being brought to the emergency departments of the hospitals. The other one major cause is the fall. Falls from the height or falls from the stairs or fall on the ground. Uh, these types of the cases uh, are, are daily coming in the hospitals, and one can see these types. They children who are frequently you sustain such type of the injuries, even in home and school and sports grounds. And the and other major one is the violence based cases, which are physical assaults when the people fighting with each other and they hit the other person's head with the hard object or blunt objects or even uh, sharp edge weapons after the gunfire. If we look to the head injuries, if the brain is affected, the injury is serious. So we treat that case as a serious for the treatment purpose always will have medical. And those cases in which the brain is not affected, patient is conscious and can speak and he is oriented to time and space. The injury is considered simple. Head injury as sports related accidents, many uh, players which are involved in the games, they sustain some head injuries during the sports activities. In most cases, skill is well protect brain from serious harm, but in some cases, the brain is involved and the case may be fatal. However, injuries severe enough to cause head injuries can also be associated with injuries to the spinal column. In cases of fall at the same level or fall from a ladder, one can sustain the spinal injuries. Spinal column injuries and their cervical spine, uh, their causes and the mechanism are as follows. Uh, Fall from, in cases of fall from height, flexion uh, is the mechanism which causes head spine injuries, and other one is the diving accident in which flexion and rotation and extension. Whiplash injury to the cervical column occurs due to compression of the neck, and it is common in bicycling or when the when children are moving. Head injuries with structures are involved in head injuries. If we look from the outside of the scalp, uh, their skin, then is a connective tissue and aponeurosis, loose relevant tissue, various treatments. These are the layers which are present in the scalp and they are involved in head. The victim of the attack very commonly suffer from head injuries, blunt force attack with sticks, bamboo, rod, or any arthroid are very common. This picture shows the scalp part which is injured, and then it is the skull which is fractured, and the brain part which shows bleedings. Skull, if we look in this slide, it shows skin layer. Scalp is made up of five. You know, scalp is made of five layers: skin, connective tissue, deep fascia, uh, epineuritis, loose areolar connective tissue, pericranium, and the this is the histological appearance of the scalp layers. And Each part is named specifically. Bruises of the scalp are associated with prominent detail. The easiest way to detect a scalp injury is by finger palpation. If a doctor palpates the scalp, uh, he will find the uh, scalp injuries under the hairs, and if hair is shaved, then it will be clear that the scalp injuries are more visible in cases of shave. Otherwise, finger palpation is enough to detect the scalp injuries. Laceration of the scalp can usually be distinguished from the inside. Here, in head injuries, sometimes laceration uh, looks like inside wound, but an experienced forensic uh, examiner can differentiate between incised wound and laceration wounds caused by the blunt hard object. And sometimes opinion uh, about the laceration is made by the doctor as incised. So it is necessary to, to check the wound by magnifying glass, and if it is needed, the edges of the wound may be, may be cleaned and examined. So the opinion should be truthful. Well, while abrasions and bruises, contusions which occur on the scalp, they represent contact injuries. It means something has been uh, hit on the scalp and that produced the wounds, and their presence will assist in the identification of the point of contact, impact, and the kind of weapon which is used. Well, another feature which is hematoma. Hematoma, scalp hematoma. A scalp hematoma is a collection or clotting or of the blood outside the blood vessels. It can very, it can be very serious if a hematoma uh, occupies the brain. The clotting can lead to pressure building up inside the brain, and the consciousness of the person, of the victim, will deteriorate in that such cases. This can cause to lose consciousness or result in the permanent brain damage. Hemorrhage. A hemorrhage is a uncontrolled bleeding. Hemorrhage is a uncontrolled bleeding in such a space around the brain uh, that called subarachnoid hemorrhage or bleeding within the tissue called intracerebral hemorrhage. Subarachnoid hemorrhage often cause headaches and vomiting uh, in head injuries. One can see in cases of uh, head injuries, the patient often vomits and complaints of the headache. The severity of the intracerebral hemorrhage depends on much on the bleeding there, but over time, any amount of bleeding can cause pressure buildup. The major outcome of the head injury is the con- concussion. Concussion of the brain occurs when the impact on the head is serious enough to cause brain injury. It is thought to be the result of the brain hitting against the hard wall of the skull because brain is very soft tissue inside the skull and it moves uh, by hitting on the it moves from side to side in cases of hard impact on the skull. The forces of such acceleration are acceleration, deceleration. Generally, we speak the loss of function associated with the concussion is temporary. It can last within few seconds and minutes. However, repeated concussions which occur, they can eventually lead to the permanent damage to the brain. While simple concussion is reversible and the patient becomes conscious within seconds or few minutes. Edema of the brain. Any brain injury can lead to edema or swelling. Many injuries cause swelling of the surrounding tissue. It is more serious when it occurs inside the brain. The skull can not stretch to accommodate the swelling. This causes pressure to build up in the brain, causing the brain to pressure against the skull. At the most serious enough injury which occurs in the result of skull fracture is the skull fracture. Unlike most bones in the brain, the skull does not have bone marrow. This makes the skull very strong and difficult to break. But forceful, in fact, forcefully hitting or penetrating bullets, they can damage the skull and cause fractures. A broken skull is unable to absorb the impact of blow, making it more likely that there will be there shall be damage to the brain. It results in the damage to the brain when the skull is broken. Now we when we are we are discussing the injuries which result consequences of the head injuries. Now we look to the brain's part, diffuse axonal injury. A diffuse axonal injury is an injury to the brain that doesn't cause bleeding but does damage to the brain. The damage to the brain cell results in them not being uh, to function. It can also disturb the function, but it can also result in swelling, causing more brain damage. It is not outwardly visible as other forms of the brain injury. A diffuse axonal injury is one of the most dangerous type of the head injuries. It can lead to the permanent brain damage and even to death of the person. A medical legal officer has to assess the nature of injuries, while we who are the treating doctors, they treat the head injuries and forensic medicine, uh, which is the subject of the medical legal officer. They assess the nature of injuries because they have to certify the injuries, nature of injuries, kind of weapons, time since inflection, and the consequences of the head injuries. They have to write in the medical legal certificate, and that certificate will go to the court or justice. So, head injury is a trauma to the head, which can include skull and the brain, cause death, or lifetime impairment. Injuries to the brain include minor lacerations, bruises, contusions, scalp wounds, and scalp fractures. Bleeding within the skull or the brain, and concussion. Now, what is concussion? Concussion is normally caused by trauma to the head, which causes the brain be shocked and traumatized inside the skull. Temporary impairment in the function, brain function, can result from this and usually only lasts for a short amount of time, within seconds or few minutes. Now, the basics of brain of hemorrhage. Two types of extraaxial hemorrhage and intraaxial hemorrhage. Extraaxial hemorrhage include extradural hemorrhage, uh, subdural hemorrhage, and subarachnoid hemorrhage. While intraaxial hemorrhage include intracerebral hemorrhage, that is basal ganglia, lobar part, pontine, and cerebral part. Intraventricular hemorrhage. Look in this picture. You can easily see the shifts of the brain uh, due to clot. Clot pushes the brain part towards the other parts. Extradural hemorrhage. Dura is a thick, tough membrane. The inner surface of the dura is lined by a transparent luminosity membrane called the arachnoid membrane. The thin layer is the biometer, which tightly hugs the brain, going into every sulcus and gyre on the brain itself. These hemorrhages are more visible in CT scan and MRI. Uh, See this slide. This shows chronic subdural hematoma compressing the brain and shifting the midline from the white line to the arrow tip. You can easily find the hematoma in the brain through this figure. Epidural hemorrhage. What is epidural hemorrhage? Epidural hematomas do not normally cross the the suture brain layers as the dura insertion is tough, thereby restriction the enlarged clot to the confines of the suture of that particular bone. They compress the brain and appear biconcave. Typically, extradural hematomas are seen in young patients who have sustained head trauma, usually with an associated scalp fracture. The sources of the bleeding is typically from a torn meningeal artery, usually the middle meningeal artery. Middle meningeal artery is more uh, prone to, to tear and cause bleeding in cases of brain injury. An associated skull fracture is present in about 80% of the cases of head injuries. This is the picture shown to you. It can easily be distinguished. The dura inserted into the coronal suture, parietal extradural hemorrhage, split between lumbar and the coronal sutures, while the lining, the right lining has shown dura inserted into the lumbar suture and occipital extradural hemorrhage constant between the lumbar and the insertion of a sagittal to scalp. I already said that MRI and CT scan investigations are more helpful to locate and diagnose the internal brain hemorrhages. Subdural hemorrhage, subdural hematoma are crescent shaped in comparison to the extradural hematoma. We can distinguish between extradural hematoma and subdural hematoma. Subdural hematomas are crescent like shape, while subdural hemorrhage are believed to be due to stretching and tearing of the virgin cortical vein as they cross the subdural space to brain into the and adjacent to the sinus. These veins rupture due to shearing forces when there is a sudden change in the velocity of the head. When the head moves, the vein ruptures sometimes. Again, see this slide which shows dura inserted into the coronal suture and extensive acute subdural hematoma, parental area to occipital area, the sutural lines, and the dura inserted Another uh, figure shown to you that is again diagnostic or the diagnostic purpose of the extent of the brain injuries, which part of the brain is involved. Now the medical legal aspects of the brain injury. Medical officer or medical officer who is attending the medical legal cases is called medical legal officer, posted at the government hospital setup, and they are given the duty to attend the medical legal cases and examine and document the injuries, signs, symptoms, and findings in a medical legal register and follow the case for treatment purpose and the investigation and get the patient admitted if needed and submit the record of the medical record to the court for the justice. So, medical legal doctor has to write patient's injury details, medical legal register with the biodata of the patient. Patient's biodata includes name, uh, mother's name, age, sex, brought by address, police constable who brought the police docket, or any relative which they complete by with the patient, or any other ambulance driver who brought the patient for identification purpose. Their names are inserted in the medical legal register. After examining the details of the injuries and signs symptoms, medical legal officer prescribe some preliminary investigations and the medical officer provide first aid treatment and then cases of admission is required, then refer the patient to the concerned department for admission purpose. Then takes the whether the patient is cured, uh, dead, or referred to another hospital to the medical record. Is the is, medical record is collected by the medical legal officer and a complete or final certificate uh, should be written by the medical legal officer and submitted to the police. And the police will send that medical legal certificate with their own investigation papers to the court for trial purpose. In such type of medical legal certificate, the medical legal officer has to write his findings of the case and with the opinion of their forensic knowledge that the nature of the case is serious, is grievous, or a simple injury, and which weapon has caused such injuries, and manner of the injuries, which may be accidental, misdirected, or suicidal, depends upon the circumstances and the history of the case. So, so it is a very uh, important work done by the medical legal officer. If we look to the sign symptoms of the head injuries, they include possible period of the unconsciousness, whether the patient is conscious, unconscious, or semi-conscious. May, there may be headache. Patient may suffer from nausea and vomiting. There may be some ocular problems, visual problems, numbness and the tinglings, paralysis of any part of the body, discharging of the fluid from the ear, nose, or mouth. Maybe there is a bruise around the eye or behind the ears, bleeding into the whites of the eyeball, unusual or slow responding pupils. You can see a ophthalmoscope in the hand of the neurosurgeon when they examine a head injury case. They look into the eyes of the patient. Change to normal breathing patterns and breathing stoppage. In severe cases, victims suffer from the concussion of the brain may experiences a brief period of unconsciousness and then consciousness, dizziness, nausea, vomiting, headache, blurred vision, concussion, loss of short uh, time memory. If the concussion is very mild, the sign symptoms will